Hello, men in uniform. It is afternoon in USA. James William Mugeni is my name, a medical clinic officer by profession and certified public manager. There's a yellow flower behind me. Those who remember those days, I think I've forgotten in Ministry of Health. Whenever I looked for family planning services, I think there was a yellow flower and a rainbow. I don't remember what it was. A yellow flower. There used to be a sign for family planning. Yes, medic colleagues in uniform, the frontliners. I normally call myself frontline because medicine is war against diseases. It's a battle. COVID-19 should have demonstrated this to you. Ebola should have demonstrated this to you. Dr. Olive Kobusingye, your book, I have vividly read it and finished. I wish I could donate it to a health worker in Uganda. But you health workers in Uganda, get this book and read. Dr. Olive Kobusingye, I have come up with a new idea and I want to share it with you health workers. The health workers are the ones I'm talking to. I hope you're listening. Dr. Olive Kobusingye, in your book, you say, to the women and men who taught us not just medicine, but how to be doctors and how to be patient in the face of much adversity. Adversity in Uganda to the health workers is now known. It's very clear. The Patient, the book written by Olive Kobusingye. Olive Kobusingye is the medical director, Mulago National Referral Hospital. She wrote this book, and everyone should try to read this book. It's a good book. It inspires, it gives you the history of what we have gone through as health workers. But Dr. Olive Kobusingye, page 1 of your book, How Did We Get Here? And just these small letters in italics, it says, medicine is a social science and politics is nothing else but medicine on a large scale. And you're quoting a German physician, Rudolf, Karl, Ludwig, Virchow, a 19th-century physician. You're saying medicine is nothing but politics. Dr. Kobusingye, I also have a book here called Inspired Physician Leadership, Creating Influence and Impact. This is what I'm aiming at. And also, I just want to read from it. It also says, while the future of healthcare remains problematic, experts agree that physician leaders must be at the table, engaged as principal players among those who will define and shape tomorrow's healthcare strategies. Yes, Dr. Olive, stand as the president of Uganda and we organize ourselves using structures, the medical structures. You know how our structures are, from sub counties to counties to districts to regions and then to tertiary national referral. So other than teachers, we have the most established structures in Uganda. And you've seen how that parliament is wasting time. Now they have passed a law on LOB, whatever they call the homosexual law. It affects us, the practitioners, the medical workers. You know it. That law doesn't work for us. And we're thousands, 10,000 who don't subscribe to that law. So what are they going to do with us who promote safer sex in these people? So I'm simply saying, Olive Kobusingye, stand for the president, and then allow us medical clinic officers, whatever, use our structures. We talk to patients. We talk to these people. We take over that parliament because they're wasting time. None of you is practicing medicine anymore. We're just wasting time. The whole of last month, and all hospitals didn't have drugs. What medicine were you practicing? And you were silent. Now they have gone and passed a law against your clients, SRH, sexual reproductive health clients, and you're quiet. And you're quiet. That's not what we want to see in Uganda today. The other day they brought tuk-tuks, 3 tricycles, motorcycles. On Ugandan roads, where will you go with those motorcycles? They can't even run in Kampala. So which other country will you take those motorcycles? So Olive Kobusingye, if you are not ready, then I'm ready. If you're not ready to be the president of Uganda, and then I am appealing to our structures, all clinic officers, every person who is running a health center, every person who is running a district hospital, every person, nurse, doctors, laboratory technologists, physiotherapists, orthopedic surgeons, orthopedic officers. Listen to me. If Dr. Olive Kobusingye, after her book, is not ready to be the president of Uganda, then I'm coming. And we don't need parties. We don't need any party. We need our structures. Our structures are health center, force, sub-county, district, whatever. All those are our structures. And if teachers want, teachers join us, because you're the next spread. You're not going to continue kneeling down before this parliament. They have passed a law of, they're comfortable in parliament, and none of them can pass a law for salaries of health workers. So health workers, James is coming as the president of Uganda. If not, Dr. Olive Kobusingye, stand and allow us to mobilize using our structures. We need to correct. The country is sick. 14 million Ugandans, maybe including me, we are mentally deranged. And we are watching. So we need to treat the country. Treating patients is ours. Treating the country is also medicine. So politics is nothing but medicine. Thank you for listening to me. Happy Saturday.